In making this film, we asked parents for questions about cow's milk protein allergy, and here are some of the questions. No, reassuringly, in a vast majority of cases, all types of milk allergy are outgrown during childhood. About 80% of children develop tolerance before 3 years of age. The speed with which one outgrows milk allergy may be different. Delayed onset, non-IG milk allergy would usually be outgrown more rapidly than immediate onset, usually between 1 to 1.5 years of age. We cannot provide a definite answer. However, risk factors for having cow's milk allergy include having a relative, which is first-degree relative like a parent or a sibling who has had history of milk allergy, or other allergic diseases like eczema, asthma, hay fever, or food allergy. It also depends on the type of allergy. The IgE or immediate milk allergy is more likely if there is a history of allergies in the first-degree relatives. In non-IgE or delayed onset allergies, this aspect is rather unclear. If your child has one food allergy or other allergic conditions like eczema, wheeze, the chances of having food allergies are slightly higher than other well babies. Lactose intolerance is another type of reaction to milk, where the body cannot digest lactose, the natural sugar found in milk. However, this is not an allergy. Lactose intolerance can be short-lived. For example, it can come on for a few days or weeks after a tummy bug. The usual symptoms of lactose intolerance include diarrhea, vomiting, rumbling stomach, tummy pains, as well as windiness. If you're concerned about this, please get in touch with your GP, healthcare professional for advice. Lactose-free formulas are not suitable for milk allergic children as they contain milk proteins which cause the problems. Unfortunately, accidental exposures to milk do happen despite parents being very cautious. Please remember to read labels so as to avoid any accidental exposure as far as possible. Children will develop symptoms on accidental exposure depending on the type of allergy, the amount of milk taken, and their previous symptoms. Symptoms should resolve once the protein clears from their body. Monitor symptoms closely, especially if your child has immediate form of allergy, and follow your allergy action plans as provided by your pediatrician. Occasionally, this can be a blessing in disguise, as in delayed non-IG allergy, you might be able to start a milk reintroduction plan should there be no symptoms after accidental exposure. Unfortunately, other mammalian milks are not suitable as they are 95% similar to cow's milk protein, and there is a risk of reaction with these milks. Moreover, they are not adequately nutritious to provide the sole food source for these infants. It is advisable to consider a milk-free formula as advised by your healthcare professional. Yes, even though beef is obtained from cow, it is not a dairy product and does not have any cow's milk proteins. Egg is not a dairy product and does not need to be excluded. Unfortunately, this misconception occurs as eggs are placed next to milk in the supermarkets and both of them are derived from farm animals. However, eggs can be safely consumed as long as your child is not allergic to eggs. Most children outgrow their milk allergy and will not have any long-term impact on growth or on their gut. Once your child starts a milk-free diet, any changes to their gut and skin would gradually reverse following milk removal. Any growth issues should also gradually reverse, and if there are any concerns regarding this, please get in touch with your dietitian. The main nutrients which may be affected following cow's milk-free diet are calcium and iodine. If you choose milk alternatives that are fortified with calcium and iodine, there is no reason to be concerned. Thank you for listening, and I hope you found this useful. We have displayed a few QR codes in this talk, which links you through to online information leaflet and resources relevant to this section. Open your camera or download the QR code reader on your phones, and this will enable you to scan the QR code and access the information. Finally, if you can scan the QR code, on the bottom right, it will take you through to the survey regarding this talk. It will be really useful to get some feedback on how we can improve this in the future. Thank you.